Hi everyone, myself Dr. Arya. Today we are going to talk about medical termination of the pregnancy. First and foremost, if the woman is more than 18 years of age, consent of the woman is enough to undergo medical termination of pregnancy. There is no need for consent of the husband or the partner or the parents. If she is less than 18 years or mentally not sound, consent of the guardian is needed to undergo MTP. Next question is, what is the period up to which you can undergo MTP? As per MTP Act 2022, when the pregnancy is less than 24 weeks, you can safely undergo MTP. When the pregnancy is less than 20 weeks, opinion of one medical practitioner is enough to undergo MTP. And if you are opting for MTP because of contraceptive failure, you can only undergo MTP till 20 week of gestation. But there are certain indications where you can also undergo MTP till 24 weeks of gestation. Those are: first, this pregnancy is due to rape, incest, change of the marital status of the woman, that is, the woman became a widower or a divorcee, pregnancy in a mentally unsound female, congenital malformations or genetic diseases in the baby. And in case of natural calamities also, you can undergo MTP till 24 weeks of gestation. Okay, let's see what are the indications of MTP in India. First is medical indication. Continuation of the pregnancy is detrimental to the woman's health. That is, pregnancy in a woman who is having severe heart disease, seizure disorders, uncontrolled epilepsy, uncontrolled diabetes, uncontrolled hypertension, chronic kidney disease. Second indication is humanitarian indication, that is pregnancy due to rape. Third indication is eugenic indication, that is the baby she is conceived with is having certain congenital anomalies or genetic disorders. Socioeconomic indication, that is failure of contraception or the couple is not able to have one more baby. Who can do abortions? A gynecologist, that is who is having diploma or PG postgraduation in obstetrics and gynecology, or an MBBS graduate who has experience in obstetrics and gynecology at least for 6 months can safely do MTP for you. And MTP can be performed in any government hospitals, private hospitals which are approved by district health services or chief medical officer of the district. Your details and all documents should be kept confidential unless it is a case of POXO where doctor have to inform the police and they have to file an MLC. Otherwise, these documents will be kept confidential. When you're having certain medical disorders, medical termination of the pregnancy can be detrimental to your life. So, you need close medical monitoring. That is, whenever you're a patient of severe heart disease, severe hypertension, chronic kidney disease, seizure disorders, you better admit in hospital and undergo MTP. Let's go to the procedures of MTP. There are two methods. One is medical methods of medical termination of pregnancy and surgical method. When the pregnancy is less than 12 weeks, surgical methods are preferred over medical method. And when the pregnancy is more than 12 weeks, medical methods are preferred. But both can be given in most commonly used is FIGO regimen. Go to the doctor, you consult a doctor, your doctor will do basic blood investigation for you, such as your hemoglobin, your blood group, and certain other investigations. And your doctor may also advise you an ultrasound for the localization of the pregnancy and to confirm the gestational age for you. And then, if you're a low risk case, you will be given medications that you can also take it in at home, but you always make sure that you will be having a 24/7 emergency services available. That is, Whenever you're having severe bleeding, whenever you're having any problem, you should be able to contact your doctor. Otherwise, this MTP can be life threatening as well. And when you're undergoing surgical methods, that can also be done as an OPD procedure when you are a low risk case, and you can get discharged by the evening. When it is a second trimester abortion, you will get admitted, and 2 days process you need to get MTP done. After your abortion is done, you better come back to your doctor after 2 weeks so that your doctor can assess the symptoms, whether you are having persistent bleeding or whether you are having any other symptoms. According to that, she can evaluate you, and if you're having anything left inside of your uterus, she can also prescribe you another methods. And it is better for you to conceive 3 to 6 months after an MTP. The most important thing is, whenever you're having a negative blood group after you're undergoing MTP, if it is less than 12 weeks, you better get a injection anti-D 50 microgram IM, and if it is more than 12 weeks, you have to receive injection anti-D 300 microgram for avoiding future pregnancy RH alloimmunization risk. Okay, then we can proceed to the complications of medical termination of pregnancy. First and foremost is the torrential hemorrhage. If you're having MTP at home under prescription of the doctor and you started bleeding, bleeding is normal during MTP. But if you're having heavy bleeding, that is, you change it 2 pads per hour for the consecutive 2 hours, you immediately go to your doctor and get admitted. You need a close monitoring. And another risk is septic abortion. If you're undergoing abortion in any septic conditions, or there is also a risk of septic abortion in any procedures, because there can be infections, right? So that can also cause septicemias, and it can also kill you. And there is definitely a risk of uterine perforations and other in case subfertility issues after an abortion. It is prevention is always better than cure. So if you are sexually active and you don't want to have babies, you always use a contraception so that you will be safe and healthy, and always have safe sexual practices.